We are starting to get a clearer picture of who will lead U.S. health policy. This week, the FDA appointed Vinay Prasad as the director of the Center for Biologics Evaluation and Research. And the White House announced it will also nominate Casey Means for Surgeon General.
Our medical expert, Dr. Payal Kohli, is here with some insight on these names, because these names are new to most of the American public for the most part. I know Sam was doing a little research on them today. Yeah. So, I mean, who are these folks? Let's start with Prasad. What is his role, or what would it be in health policy?
Yeah, so he's an oncologist, and he's at UCSF. And essentially his role is going to be sort of the vaccine advisor to the CDC. So he's going to evaluate all new vaccines. He's going to advise not just on vaccines, but on gene therapy, on any biologics, which are any injectable medications. And if, God forbid, we have another pandemic, it would be his job to approve the vaccine, assess the safety, and say whether or not it should get out there.
Wow.
It's a big responsibility.
I was going to say a very important position.
Right.
Do you agree with his positions? Can you talk to us about some of the things that he believes in?
Yeah, so during the pandemic, he actually came to fame because he started saying that the CDC had it all wrong and they shouldn't have approved vaccines, the COVID vaccines, for young children. So that was one controversial and scientifically incorrect thing that he was propagating. The other thing that he says, which is absurd in the medical literature, is that every year, whenever we get another version of the COVID vaccine, we should do another trial to assess that vaccine for efficacy, even if we've just tweaked it a little bit. And I don't know if he thinks we're going to do this for the flu shot and for all the other vaccines that we keep updating as well. But you can imagine the resources needed for that. You can imagine that's not practical because it takes months to do a vaccine trial, and it's going to prevent really the vaccines from getting out there. So the fact that the vaccine advisor has so much vaccine hesitancy, it makes me nervous about where things are going to be headed.
Yeah, and what kind of checks and balances are in place to, potentially move things in a different direction. Okay, enough there. Let's talk about Dr. Casey Means. What do we know about her? This is a name I first heard for the first time this week.
Yeah, so she actually went to undergrad at Stanford, medical school at Stanford, and then went to residency at OHSU. Didn't complete her residency. It was a surgical residency. She dropped out, saying she became disillusioned with medicine, decided to start a functional medicine practice where it's a lot of homeopathic and alternative medicine. Also is a big believer in supplements, and mind you, hasn't had an active medical license for some time. So putting all that together for her to be the Surgeon General, which is the top kind of public health advocate role, it's a little alarming as a choice because someone's not actively practicing medicine, hasn't even completed medical residency or surgical residency to actually be a full-fledged physician in the U.S.
And she's been pretty outspoken. So what are some of the issues that she has been outspoken about that you yourself take issue with?
So I agree with the one thing that she says, which is that a lot of the root cause of disease is metabolic health. If we can be better about what we eat, high blood pressure, cholesterol, diabetes, obesity, controlling those factors, we're going to improve health. So I think that I'm 100% behind her, and hopefully she'll make that her platform. But what she says about vaccines, she says we shouldn't be giving newborns vaccines because we're plugging them into the pharmaceutical industry a little bit too early. We should be using supplements to heal, which are not, by the way, FDA approved or backed by scientific evidence. These are much more skeptical claims that she's making.
And how would that change things? My daughter just turned 1, and I took her, that 1-year appointment. You get like 4 different vaccines, MMR, which is really important right now. Just as a mom, it terrifies me that these sorts of resources could be essentially taken away. I mean, is that what we're looking at?
Yes, because if the Surgeon General, who's America's top doctor, tells moms you don't vaccinate your children because it's not good for them, and then you've got the vaccine advisor also bolstering that message to the CDC, then those recommendations will get taken away. And it doesn't just mean that people won't do it, it even means insurance coverage might get taken away for some people that even choose that they want to do it, because if it's not recommended anymore by the guidelines, by the CDC and the vaccine advisory committees, people won't do it. So again, we saw with measles what happens when we don't give people the vaccines that they need. We bring back diseases that are eradicated. A baby's immune system is like a blank slate. You are exposing them to undue risk, potentially lifetime complications, potentially death, by not giving them these vaccines. So leaving our kids unprotected, even our elderly, to me, I'm really concerned. So I'm hopeful that these are just messages that they used to get the position, but once they get into the position, they'll start focusing a bit more on the science and really driving behavior based on science, because we saw RFK Jr. backtrack on the measles vaccine as well, even though for the longest time he had been saying that he's not sure about it.
It's just scary.
We have kids, And I know really quickly, of like 15 seconds, but the Trump administration has terminated that federal advisory committee that issued guidance about preventing the spread of infections in healthcare facilities. So with all of this, how do you think quickly this will impact healthcare moving forward?
I just hope that they redistribute the tasks, because this committee was going to come up with updated guidelines saying don't wear surgical masks, wear N95 with contagious illness. They were working on those guidelines and they're gone now. So hopefully this doesn't mean it's just a top-down system. It just means they're repurposing, and they really hopefully will select scientists and not people who are just saying what they need to say to get the office.
Okay. Thank you for sharing some information on this. We all need to know. Dr. Kohli, thank you.